management and patient safety audit in hospital pharmacy. To speak on the topic, we have Dr. Parvez Ahmed, Director Chandan Hospital, Lucknow. He has more than 23 years of experience in clinical and hospital operations, including planning and designing healthcare. He is associated with various national and international accreditation bodies. I request you, sir, to start the session.
Explanation of medicines. This is very important that all the pharmacist has to properly explain and counseling to the patient about prescribed medicines which enhance the patient safety, compliance and satisfaction of the patient. Next. Audit cycle. I think I will not go into the detail. We are all well aware about the audit cycle. Next. So these are the examples of pharmacy audit which can be done, that legal compliance audit can be done, manpower related audit can be done, that how many prescriptions are dispensed by the pharmacist, prescription audit, stock audit, expiry or near expiry medicine audit, adherence to pharmacy policies, procedures, medication error, quality indicator, etc. if they are applicable. Next, please. So thank you so much to brief that to that there are three types of audit in pharmacy which are applicable. Number one is internal audit, which we also call it as a first party audit. This internal audit is done by the organization, the same organizations which are the different officials are there, or it can be also done by the same organizations if in a one city or another cities two different organizations are there. So that's also called the internal audit. External audit means that which is done by the second party. Second party means which are the stakeholders involved in the hospital care. For example, your third party administrator or like ECHS, CGHS inspection, the stakeholders when they come, they which audit they might do, that's called the external audit. And third audit which is applicable to the hospital pharmacy is regulatory audit, which is called as a third party audit, and this audit is done by the regulatory bodies or like a drug inspector or drug licensing authority. So these are the three types of an audits which are applicable to the hospital pharmacy. And the next there are the subtype of audits which we do in the hospital pharmacy. Number one is adequacy audit, which has been are done to check the adequacy of the pharmacy services. Next is document audit. In this audit, we check the documentation, the compliance of documentation in terms of various formats, etc., etc. Compliance audit also can be done to check the legal compliance and to check the other compliance. And fourth is the product or process related audit, which can be done in the pharmacy. Next, please. So these are the six pillars of any quality and safety audit. It is not only applicable to the hospital pharmacy, so it is applicable to the entire industry, the different kind of industry including the hospital or various department. Number one, that legal strategy. If let's take an example of radiology department, or let's take an example of lab or hospital or the pharmacy. So how we are going to audit it? So if we remember these six pillars, we cannot miss anything during the audit. Number one is that to check the legal or statutory compliance applicable to particular department. Number two, infrastructure. Infrastructure especially means the civil. What are the civil requirements? What should be the size of the pharmacy? If we are doing audit of the radiology in terms of CT scan or X-ray mammography, what should be the size of that room? Manpower. What is the minimum requirement of the manpower? Or what are the qualifications they require? Next is instruments or equipment. What are the minimum essential equipment or instruments required to run that department or to run the pharmacy? What are the documentations you have to maintain in terms of manual, SOPs, policies, form formats, etc. And the last thing is to check their implementation and to check the practices, how they are doing. So these are the six pillars of hospital pharmacy to doing the quality management and safety audit. Next, please. So let's go by one that in hospital pharmacy, what kind of legal compliance we have to check during our quality and safety audit. Number one, definitely we have to check the pharmacy licenses, which different licenses are applicable. And now these are days one license is coming and the validity of that license is 5 years. Then we have to check the NDPS license if pharmacy or hospital is using that narcotic drugs. FSSAI license, definitely, because all the pharmacies, they are keeping that food products like antioxidant, multivitamin, protein powder, etc. Pharmacist license, that valid pharmacist license, and indirectly some of the HR. That can be because in the sometime when we do the manpower audit in the hospital pharmacy, so sometime we go to the map the manpower, so we can also check during the legal what are the minimum wages are applicable, PF, ASI, etc. has been applicable, or they are doing that or not. Next. Next is infrastructure. We have to check the size of the pharmacy. The minimum requirement is for the any pharmacy is 100 square feet, which may vary from state to state. Appropriate light and ventilation supposed to be there in the hospital pharmacy, and there should be adequate space for movement of staff, because if big pharmacy, two, three pharmacies, there are a lot of medications, rack, etc. are there. So how the staff is moving? What are the inner circulation of their movement? Next is adequate locker or that cupboard for storing the narcotic drugs, and easy accessibility for emergency medications, that how they are storing, and display of licenses. Next. Manpower, as I mentioned, that we have to check the registered pharmacies, that's supposed to be registered with the State Pharmacy Council, and adequate support staff to run the pharmacy in appropriate and adequate number. For example, big pharmacy, they might be having a provision for billing guy or cashier separately. Next. Equipment in pharmacy, we have to check definitely, because some of the medications which supposed to be kept as per the manufacturer recommendation between 2 to 8 degrees Celsius. So that freeze is there. And if the hospital pharmacy is storing the vaccines, so that ice-lined vaccine refrigerator is supposed to be there. Then the thermometer, air conditioning, because in a hot cities you require a ambient temperature to store the pharmacies, and its calibration and preventive maintenance of the equipment. Next. The fifth part is of the hour is documentation. So as we are doing the quality management and safety audit of the pharmacy, so we have to check the pharmacy manual, availability of the pharmacy manual, availability of drug formulary, that which is available with the pharmacy, as well as which supposed to be available with the clinicians. Different forms and formats, medicines list, various lists which are upcoming in the upcoming slides, pharmacy records, and duty rosters of the pharmacist. Practices, in the last sixth point, we have to check the implementation of their practices, their SOPs, manual protocols, etc., etc. So these are the six pillars. If this is the foundation, if we keep these six pillars in the mind, we can effectively do the audit, and we can develop our own checklist for doing the effective audit. Documented policies, as we know that in hospital pharmacy, there is supposed to be documented policy and procedures which must comply with the applicable laws and regulation. Applicable laws and regulation means that hospital pharmacy should adhere to the Pharmacy Act, NDPS Act is if it is applicable, FSSAI Act, and Drug and Magic Remedial Act. So these are the acts which supposed to be kept in mind, and we should have a documented policy about the procurement, how we are going to procure the medications, consumable supply, how we are going to store it. We should have a drug formulary. We should have a well-defined prescription policy, who is authorized to write the prescription, who is authorized to dispense the medication, then who is authorized to administer the medications, who is going to monitor it, near expiry policy, recall policy, and use of medication policy, including cut strips policy, that should be available in the hospital pharmacy. Next. Medicine list and storage. As I mentioned that we should have a couple of medicine list. Number one, that emergency medicine list. So emergency medicine list, the reference can be taken from the WHO essential medicine list or the national emergency medicine list defined by the Government of India, MOHFW. Emergency medicines supposed to be kept in a uniform manner, and they should be easily accessible and immediately replenished after its use, including the pharmacy. Backslide, please. Look-alike drugs, we should have a list. Sound-alike drugs, we should have a list. We should also have a defined list about the high-risk medications. And we should also have a list that over-the-counter medicines as per the hospital policies, that which medicines can be sold off without a prescription and NDPS medicine list. So these are the lists which we should have in the pharmacy, and different lists can be shown, as well as medications can be arranged according to that order. Next. The storage of medications very, very important, because it's depends on the efficacy and effectiveness of the medicine. So we have to ensure that all medications are stored properly. So medicines supposed to be stored in a clean, safe, and secure environment. It should be on the ambient temperature with proper light and ventilation. And these medicines supposed to be protected from pests, rodents, and worms. We can also have a register for that. And very importantly, that incorporating manufacturer recommendations. So as per the manufacturer recommendations, we have to store these medicines. Vaccination stores supposed to be done in a dedicated ice-lined refrigerator, which are dedicatedly designed for storing the vaccinations, and good invent control practices to be followed. Next. So inventory control and methods, it's very important. In fact, all the pharmacies, they are doing inventory control in their own manner. And so this is the method of supervising the intake and use and disposal, including adequate supply of medicines products and balancing cost of various goods in hands which are available in the hospitals. So different methods are there. We will not go into the detail. So first in, first out, first expiry, first out, ABC method, as well as vital, essential, desirable. So some of the this can be clubbed together, and based on the ease and convenience of the hospital, they can do the inventory control management, and we can also do the audit based on these practices, what kind of methodology they are applying it. Next. Dispensing. So dispensing, as we know that it's dispensing always supposed to be dispensed by the qualified and registered pharmacist. Medications supposed to be checked prior to dispensing to ensure that they are fit for use. So at least their efficacy, effectiveness can be maintained. So pharmacist has to check that they are before dispensing, they are checking the expiry. They are also seeing the batch number. They are also giving the attention of the broken of seal or packaging, etc. of the drugs, and any change of color, consistency in terms of liquid drugs like syrup or IV fluid, etc. And high risk medications orders supposed to be verified before the dispensing. Next. Prescription audit. So that's supposed to be done on a regular interval with adequate sample size. So these are the some parameters we can take during the prescription audits, like demographic details of the patient, then doses, route, frequency, legibility of the doctor's handwriting and prescription, any history of allergy, uniform locations, and presence of any therapeutic duplication, drug interaction, food interactions can be captured during the audit. And this is also a mandate by the National Medical Commission that hospital doctor's name, signature, and qualification supposed to be there on the prescription with their registration number. Next. Adverse drug reactions and adverse drug event. So this is also important, which all the pharmacists should know, that what is ADR and what is ADE. So I think I presume that we all must be knowing it, ADR and ADE. A lot of people, they got confused between the ADR and ADE. So this is also a part of medication error. So an adverse drug events, always remember that event means something big is happening. So some kind of injury, an injury which is resulting from the use of drug, that's called the adverse drug event. So we have to be, all the pharmacists should be trained to know the ADR, ADE, and their hospital protocol, and which supposed to be audited by the internal auditor or maybe external, whatever. Next. Training and awareness, it is very important because we have to check the implementation. So we have to check the knowledge of the pharmacists, that how efficiently they are working in the hospital pharmacy. So number one, that we have to check that they are properly trained and aware on patient rights and responsibilities, because problems come there when we don't know that any other rights. So we don't know the patient rights, that what are the patient rights, and if there is any breach of the patient rights, that might lead to any issue, including any medical legal issues. So they should be well aware about their pharmacy policies, procedures, and processes, which might ask during our audit. ADR and ADE procedures, what they do in terms of ADR or ADE, if there is any role or not, what responsibility they have in terms of ADE. Medication errors or incident reporting, what are the methodology or mechanism for any medication errors or during the incident reportings. Various safety codes, they must be well aware about that. We can ask that if that hospital is practicing various codes like child like for example violent person, fire, or any emergency situation like cardiac arrest or fainting. So what they're supposed